Hello, I'm doing interviews to explore the impact of mural creation to develop aesthetic empathy. First question is kind of explain your role here and what you do.
I am a senior program director and a psychologist. I oversee the child and adolescent unit on adolescent 1 and the young adult and pediatric bipolar unit on child and adolescent 2.
Okay. Call to mind one particular memory when you were really aware of the mural. What was going on at that moment and what did the mural make you feel?
I would say one memory that I have where I was really attending to the mural was a time when I saw one of our really high acuity patients painting. This is actually something I was just thinking about over the weekend. One of our patients that had a history of extreme ingestion, self-injurious behavior, and I walked out on the unit one time and she was painting, using all these items that typically she wouldn't be safe with. But there was something about the process of painting and I don't know if it was putting her mark on the wall or using creativity. She's a really creative kid, but just seeing her engaging in treatment was beautiful to see. It was somebody who otherwise was having so much difficulty. And I would say for me, that just was so encouraging that she found an outlet in a way that she could be really working on herself.
Okay, think of a time when you were walking down the hall before the mural was there. Now think of what it's like now, and what is the difference for you?
Well, before the mural was there, it was very sad, very stark white and this gray teal, but that was more of a cool color. It felt like a hospital. It wasn't as inviting. And now that we have the mural, it's really brightened up the unit. It makes it feel warmer. It makes it feel more inviting.
Okay, what if the mural was a person? Can you imagine what the mural might say to help you deal with being in an acute psychiatric environment, whether that's work or as a patient?
I think that the mural really welcomes patients, so I think it would definitely say welcome. I think it's comforting for patients too, and it can really inspire hope. So even saying, we can get through this together. You look at some of the different elements of the mural. We have a beautiful landscape with a bridge and a dog, and then on the other side we have a roller coaster with kids who look like they're enjoying themselves. So it's encouraging, I would say.
Okay, if the visual aesthetic environment can influence healing and can communicate self-worth for both staff and clients, can you think of any ways that the collaborative mural creation could be a positive change agent?
Absolutely. I think that it is a positive change agent because it really helps the patients have a creative outlet. It can help them feel like they are like they have a sense of mastery, like they're learning new skills, even learning new coping skills, learning new distraction skills, getting better at a skill, and that can be really, really helpful for treatment and really for self-esteem as well.
Can you think of any barriers that might impede the creation of these kind of restorative aesthetic environments in this kind of a setting?
I would say one is property destruction. Some of the kids do have a tendency to do things that are not preferable, like taking screws out of the walls and trying to rip off the trim. And sometimes we've had a couple incidents where they've written on the mural. I will say, however, I was actually talking to staff about this morning. There's a lot less property destruction in the area of the mural, so it actually kind of protects the unit in the areas where the mural is located, because most of the kids, they don't want to do anything to harm the mural because it's something that they value.
Okay, this is kind of a program evaluation, a couple questions at the end. What do you like most about the mural project, and what is one thing you would like to change or to improve the mural project?
I like the collaborative nature of the mural project, and that the patients are really encouraged to use their creativity, and they're the ones that are actually making the mural. As far as something to change, I would say it would be great if we could get maybe more of the kids involved, or if we had more time available. With the programming as it is right now, things are pretty tight. But it would be great if we had more time where the kids could be working on the mural, or more areas where we had the mural, because we have a lot of blank wall space right now still, even though the mural's very large.
Okay, thank you very much. Hi, I'm doing interviews to explore the impact of mural making to develop aesthetic empathy. First question is, just kind of let me know your role here.
Okay. I am the program director for the dual diagnosis unit. Prior to that, I was the program director for the general adult unit.
Okay, first question, call to mind one particular memory when you were really aware of the mural. What was going on at that moment, and what did the mural make you feel?
Actually, it happened twice for me. Back in last April, when I transferred from the general adult unit, which didn't have a mural at the time, to the dual diagnosis unit, which did, walking onto the unit and getting like a different feel than on the 11th floor. It was kind of like a homey, warm type of feeling when I walked on the unit.
Okay, think of a time when you were walking down the hall before the mural was there. Now think of a time when the mural is there. What was the difference for you?
Well, that I can reference back to the 11th floor. When I worked on the 11th floor, there was no mural. So at times it seemed kind of sterile and just reminded you that you were in a hospital. And then just from stopping on the 11th floor to visit other staff members, it's a completely different feel. Again, it kind of has that homey, relaxing feel, sort of. So.
And if this mural was a person, can you imagine what that mural might say to help staff or patients to deal with being in an acute psychiatric environment?
Maybe, welcome. This is a comfortable place. It demonstrates that it's an important place, and that we kind of take pride in the environment, and that it's more than being in a hospital. It kind of sends the message, like we want folks to just feel comfortable and relaxed.
Okay, if aesthetic visual environment can influence healing and communicate self-worth for both staff and clients, then how can you imagine any ways that collaborative mural creation could be a positive change agent?
Yeah, I think you could have maybe patients and staff participate in like making a decision on what they want with regards to the mural. You can have them work together in creating it, or you think of something that would represent the unit, so that it kind of brings like a sense of we-ness between staff and patients, which I think is important.
And what are some of the barriers that would impede the creation of these kind of restorative aesthetic environments in these kind of settings?
I guess the main one I can think about or come up with is just what types of tools are necessary to create them. Are they safe to kind of have in an environment like this with regards to an individual's capacity to self-injure or to harm other people? We just have to be careful what we use to create the mural.
Okay. The last question is two parts, and it's kind of a program evaluation type question. What one thing did you like most about the mural project, and what is one thing you would do to change or improve the mural project?
What I liked most about the mural project is how Dave kind of got input from staff and patients, and also had some of the patients participate in creating the mural. I think that was awesome. And what I would change is that I would make it something that was available for all the units. So,
All right, thank you very much.
you're welcome.
Hello, good afternoon. I'm conducting interviews to explore the impact of mural creation to develop aesthetic empathy. I guess the first question would be kind of explain your role here.
I'm Program Director for General Adult Unit here at the Psychiatric Institute.
Okay, first question is call to mind one particular memory when you were really aware of the mural, what was going on at that moment, and what did the mural make you feel?
I think when the mural first started going up, that it was such a big change from the way it was, where it was kind of drab institutional walls. The one of the first things kind of put in was the sun, and I remember walking onto the unit and feeling just really happy that it was kind of something from the outside, something beautiful, something to kind of be different and really nice to have there. And you could kind of already see the style and what was taking place. So it made me really excited and anticipatory, and it was good.
All right, think of a time when you were walking down the hall before the mural was there. Now think of what it's like to have the mural there, and what is the difference for you?
Beforehand it was just a hallway. I can't really say that I took much notice. It was a place to get from point A to point B. And again, just kind of a hallway. Now with the mural there, and especially seeing it going up in stages, is that it's it's a piece of artwork, and it's something that it makes the hallway more than just point A to point B. And since our patients actually do spend quite a bit of time in that hallway during meal times and during med pass and stuff like that, that I think it gives time for possibly contemplation, to actually see this piece of art there that wasn't there before, and that you don't see in very many places.
Okay, what if the mural was a person? Can you imagine what the mural might say to help you deal with working or being in an acute psychiatric unit?
So in terms of what the mural might say, I'm not actually sure of specific words or specific phrases, but I feel like that the mural gives off kind of the personality, if of a person, if we were talking about that. In that, I feel like it's very bright and that it has a lot going on with it, pretty vivacious and full of energy. But at the same time, there's a certain calming aspect to it, and I feel like that's with the brushwork and how everything kind of flows in together. So I imagine this person is kind of enthusiastic and excited, but at the same time calm and contemplative at the same time, which I don't know, I feel is pretty good qualities for a therapist.
Okay, if aesthetic environment can influence healing and communicate self-worth for staff and clients, and then how could the mural, can you think of any ways it could be a positive change agent?
I feel like this, because our particular mural is scenes at the outside, which was something that was actually requested by both patients and staff when it was kind of in the beginning phases of it. That it's kind of the outdoors. It's Pittsburgh building. It's kind of recognizable things, and I feel like having that outlet to the outside, because we are behind locked doors. Even staff during the working day are behind locked doors. That it gives kind of an outlet, and it gives a reminder that the world is outside there, that there are things going on, and to hopefully work on wellness so that you can get back outside to the world that's waiting.
Can you think of any barriers that impede the creation of these kind of restorative aesthetic environments in a psychiatric setting?
My concern is kind of so specifically is that when patients drew on the mural, this happened a couple of times, and it's seeing that defacement, which a lot of our patients are psychotic, so it's not unexpected that this would happen, but it's kind of upsetting, and it's again one of those things that we kind of expect, but seeing it messed up.
Okay, the last question is kind of program evaluation kind of questions. So the first part of it is, what did you like most about the mural project? And the second is, what would be one thing you would change or could be used to improve the mural project?
Mm-hmm. We have a variety of patients on our unit. Some that have been here for a very, very long time and have seen kind of the nascent stages of the mural, to others that are here very quickly. One thing that I really, really, really appreciated was the fact that when the artist was here doing it, is that patients got a chance to go talk to him and ask questions. And I really, just personally, I would take patients out into the hall to come watch it, to come watch it going up, to ask Dave questions, to see it where there was kind of more a peaceful moment. And I really saw patients that were very psychotic or very depressed kind of come out of themselves and really respond to what was there. And I love watching that. I think it was so helpful for the patients that really responded to that. I don't know about improvement. I mean, I would love to have it not just in our hallway, but kind of all over the unit. But I don't know if that's actually that's not possible with kind of what's going on.
Okay, thank you for your time.
Thank you.